Melatonin, hormone often pineal gland, decrease symptom of jet lag. Side effects are lowering of seizure threshold and psychiatric changes. Rameltion, receptor agonist of melatonin. Stole, short-acting benzodiazepines are triazolone, temazepam, oxazepam, lorazepam, istazolone. Parkinsonism, decrease in neurostriatal dopaminergic neurons with appearance of Lewy bodies leads to cholinergic activity become dominant. Drug increases dopaminergic activity in brain. Dopaminergic precursors, that is levodopa and carbidopa or benserazide, drug of choice for initiation therapy in elderly. Rigidity or bradykinesia respond well than tremors. Side effect arrhythmia, postural hypotension, nausea. Abnormal coriform movements occur on long-time high-dose therapy. Drug inhibiting metabolism of dopamine, COMT inhibitor, that is tolcapone and entacapone, toxic to liver. Selective MAO-B inhibitor, rasagiline and selegiline. Dopamine receptor agonist, first choice of drug on a young patients, bromocriptine, pergolide, pramipexole, ropinirole. Drug increase dopamine level at synapse. Amantadine, antiviral, increases release and decrease reuptake. Side effect leads to reticularis and ankle edema. Brain cholinergic transmission inhibiting drugs. Central anticholinergic like benzhexol, benzatropine, and piperidine are drug of choice for drug-induced Parkinsonism. Pramipexole and ropinirole are first-choice drugs for Parkinsonism. Alzheimer's disease, deposition of amyloid plaques in hippocampus, that is neurofibrillary tangles. Donepezil galantamine, rivastigmine, never-cholinesterase inhibitor used in Alzheimer's disease. Memantine, NMDA antagonist, decrease Alzheimer's disease progression. Rivastigmine reused as therapy in dementia due to Alzheimer's disease and Parkinsonism. Seizure is one episode. Epilepsy is recurrent attack of seizure. Convulsion, abnormal movements. Febrile seizure and infantile spasm are unclassified form. Lennox Gestalt syndrome, epilepsy with impaired cognitive function. Adenosine is endogenous anti-epileptic substance. Mechanism of epileptic drugs. Inhibition of use-dependent sodium channel, phenytoin, carbamazepine, valproate, topiramate, lamotrigine, induced in depressive phase of manic depressive psychosis. Increase in inhibitory neurotransmission, that is GABA, barbiturate benzodiazepine, ganaloxone, gabapentin, drug of choice in diabetic and post-herpetic neuralgia, and vigabatrin, which is inhibitor of GABA transaminase. Decrease excitatory neurotransmission, felbamate, side effect is aplastic anemia, and topiramate, which side effect is renal stone. Inhibition of calcium channel, T-type calcium channel are important. In absence seizures, ethosuximide, valproate, and lamotrigine are useful in petit mal epilepsy. Drug of choice in various seizures. Absence seizure in children, ethosuximide. Absence seizure in adult, valproate. GTCS, valproate. Atypical absence, valproate. Partial seizures, CBZ, tonic valproate, clonic valproate, atonic valproate, myotonic valproate. Infantile spasm, ACTH, infantile spasm with tuberous sclerosis, vigabatrin. Febrile seizure, diazepam. Status epilepticus, lorazepam. Epilepsy in pregnancy, phenobarbital. Seizure in eclampsia, magnesium sulfate. Gabapentin, visual field defect. GABA, TR, transaminase, mechanism of action in is inhibition. zonisamide and topiramate cause renal stone. Para, Parampenal, new selective AMPA type glutamate receptor agonist. Drugs for absence seizure: sodium valproate, ethosuximide, ganaxolone, lamotrigine, trimethadione. Antipsychotic drugs: typical neuroleptics, blocks D2 receptor. Extrapyramidal effects seen in this group as it's going to block D2 receptor. Also poses to cause cardiac arrhythmia, long QTC interval, and increased prolactin release. Phenothiazine, chlorpromazine, thioridazine, trifluverazine, fluphenazine. Thioxanthines, fluphenazole, thiothixine, butyrofenones, haloperidol, drug of choice for Huntington disease, droperidol. Atypical: clozapine, olanzapine, quetiapine, risperidone, ziprasidone, aripiprazole.